Good morning. This is Nancy and Pete, and we're happy that you joined us. If you didn't see the last one last week, that was the first part to OCD. And so we talked about all of the characteristics of someone that could be diagnosed with that. And now today, Pete is going to talk about some techniques that therapists can use for those patients.
Yeah, probably the biggest one, it's exposure and response prevention.
Okay.
I never get that one straight. I have to think about it. But what it is, this is probably the most common treatment I think that therapists use for OCD. And it's kind of been, I was reading where OCD is kind of like when you have an alarm system in your house, but you have it sent too sensitive, like if a mouse goes through, it goes off and notifies the police. And that's sort of what OCD is. It's this alarm system that just kind of goes nuts, out of proportion to whatever the stimuli is. So when you go to a therapist and they start this type of therapy, first of all is they kind of sit down with you and they talk about four basic things. And the first one is exactly what is your obsession, or what is the intrusive thoughts.
Okay.
Then the second one is your mental and physical rituals that you do in response to that. Like when I was talking last week, mine was going up and checking my doors constantly.
Right.
So then the next one, what is the fear that you think will happen if you don't do the rituals? And then the last thing is, what do you do to avoid the stimuli in the first place?
Yeah, very proactive.
Yeah.
Get ahead of it. Yeah.
So,
Okay.
for instance, let me kind of illustrate this. One of the weirdest cases I ever had when I was at the mental health center, and I had this man come in, and his wife had this big fear of changing the cat litter.
Okay.
So, and I knew him.
Yeah.
So he says, I want you to come over and see what she has done. So I went over there, and the first thing, there was like a box up almost to my neck, all the way around the litter box. And then she had lined plastic bags all over the inside and the floor. And then she had like a place where the cat go in, but before that place, she built another enclosure with high doors the cat had to go through so cat litter wouldn't get out on the floor. So that was sort of her ritual. And plus, she would not clean it. She made her husband do it.
Right. Even though she did all of that, she still couldn't do it. So very over-the-top stimulus.
Yeah, and then the thing is, they would replace all that the next week.
Oh, no.
So he was getting really frustrated. Well, the thing with her is, the question is, what was she really afraid of, the cat litter box, or was she afraid of something else? Well, it turns out she was a germaphobe on top of that.
Okay.
And that's something I noticed, like at least in my case and a lot of other cases, is a lot of people, their OCD isn't just one thing. It can be several.
But it can be hyper-focused on one thing.
Yeah.
So that's probably a good example for this woman, that yes, she in general was a germaphobe. However, there are so many germs that she can't control. How she deals or copes with that is that she super controls the cat litter.
Mm-hmm.
Yeah.
Yeah, and I remember watching their poor cat come out, and it's like he came out of an obstacle course. And it was off way back in the back part of their room, so it was as far away as the living quarters as it could be. Yeah. So the thing is, so that was her fear, and the fact that she built this elaborate device to keep litter getting out. And also, there were tons, like I think I counted 6 air fresheners stuck onto it on top of that.
Ooh,
so she was really, so that was sort of her ritual, and the fear was, I'm going to catch some kind of disease. So then the question is, how do you treat something like that? This is really the first case that I encountered. I'm just going to
Okay.
Oh no, what do I
Yeah.
do with this woman?
Yeah.
So anyway, when you go in for this type of therapy, after you kind of discuss those things, you do it's called an anxiety ladder or OCD hierarchy. And what you do is you sit down with somebody and you have them list all the little phobias and OCD tendencies, and then you have them rate them like from 0 to 100, which one's the lowest, which one is the highest.
Yeah.
And so often, therapists will look at those and decide which one to start. Usually you start in the middle. It sounds weird. But,
yeah, you never start with the worst.
Yeah, or the
And in
simplest.
fact, in trauma therapy, they talk about that too. You don't start with the worst, but you'll start more in the middle ground, and then you can kind of assess where the person is. And the 0 to 10 or 0 to 100 or whatever rating, doing a hierarchy like that, that's something that Pete and I also use a lot with anxiety clients, as far as what are your fears, things that you avoid. And OCD is the same technique. It's a very good technique to get started on what is really pervasive in your life that is a real problem, and what could we work on that's a little bit easier than that first,
Right.
to show some movement forward and give the client some hope.
Because you don't want it to be too simple, but you don't want to start at the top where it's impossible for them to
Yeah.
make any progress. So with this woman, what I did, the first step is I had her just go in the room and watch as her husband cleaned the litter box.
Okay.
That was hard for her to do.
Mm-hmm.
I mean, he said she was like against the wall like this watching
Yeah.
him. And then it turned out, I remember one of her thoughts or got triggered is they were wanting to get pregnant, and I guess pregnant women shouldn't
Be around
run
cats.
cat litter.
And cat litter
Yeah.
in particular. Yeah,
And
that's
that is what triggered it.
true. Okay.
Although their kids were older by then, so I don't get it. So the first step was just go into the room while he changes it. So then, once she could do that comfortably, the next thing we did is I had him take down the walls.
Oh.
And that was a biggie. I mean, she's like, oh my God. So then she kept saying, oh, can we get a covered cat litter box? And I said, no, not right now.
Oh.
Because I'm
You
trying
said no,
to
okay.
get you used to this.
I was going to say that's
So-
reasonable, but I know what you're
Yeah, so that took a while for her to get used to that.
Yeah.
So then finally, we got rid of all that. The cat box was there. She had a higher cat box, so at least the litter wouldn't get scattered, which kind of
Okay.
drove her nuts. So then the next thing is I actually had her scoop one litter out of there.
Oh,
One
my.
scoop. That was all. But I told her you can't look because you can't get all,
Yeah.
she had
freaked out.
clumping litter. So, she did that one time, and her husband said, I thought she was going to die when she had to do that.
Yeah.
And then we worked on that. One scoop, then it was two, and eventually we worked where she would clean the whole box.
That's
And
excellent.
then he also limited how many. She had one of those little vacuum cleaners that would plug into the wall, little handheld
Oh, yeah.
one. And I guess she would go in like 10 times a day to get the cat litter. So the next thing was you can only go in once a day to clean the
that.
cat litter up. So eventually she got comfortable where she could actually change the cat litter, but it was like a 6-month process to get over that.
Yes, and again, some of you may be thinking, well, what's the big deal? Just let the lady do that. But you can tell from that real story, it's a real life, is that it was affecting her relationship. And also, it's not good for your health. Because again, when we talk about what's happening inside with OCD, it's setting off alarm just like anxiety. And chronic stress is very bad for all of your internal organs. So you don't want to have something that's such a big deal like that. And that you're worrying about, that you're fearful, it's affecting your relationship. And so it is important. And if you allow that type of behavior, unfortunately, if you don't get treatment from a therapist, that could build onto another thing, right? That she is building a box around, avoids, that her husband has to do. It could be a real problem.
And see, the next thing on her hierarchy was she had this big fear that her kids were going to get injured if they were away from the house. So she would drive them to school. She would pick them up. if they were doing after school activities, she remained there the whole time. It was like hypervigilance. So that's the next thing we worked on, and that took over a year for that one. So sometimes it's short, sometimes it's not. I had a client here that had a real social phobia of just going out in public, and he went to New York with his girlfriend and ended up not leaving the hotel room because he just and with him, his big fear was that people would laugh at him and ridicule him.
Okay.
And so when we started working up, because they were going on another trip, the first thing I had him do was go out to the mall to the food court. And all I had him do was go through one door, walk through, and go out the other.
Okay.
And it's funny, on the CBS News this morning, they had an episode with a guy who had a phobia like that being out. So I thought it kind of oops, I almost gave the client's name. Good, I didn't. But anyway, so we started off with that. So then when he got comfortable with this, instead of going across, he would go the whole length of the food court. So then once he got comfortable with that, he's going to go order some food, sit and eat, and then leave. And what we finally worked, so he would walk through, do a complete lap around the mall.
Yeah.
And that made him more comfortable in public. I remember he said, I don't think people even noticed me. And I'm thinking, yeah, they're probably not going to unless you're in a clown suit or something.
Yeah.
So it got better. He still struggled with it, but it wasn't as much of a struggle. And that's the thing is, I know from stuff from OCD, it never completely goes away.
Yeah.
But you get it to where you can manage it and it doesn't cause the anxiety. Like when we left the other day, I said, yep, check the door twice, and then I was done. I'm gone. Now, I don't think I'm ever going to get where I can do it just once and leave.
Yeah.
But 2 from 40 is not bad.
That's right. And it's fine. It doesn't affect your life.
Yeah.
Right. But building a big thing around your cat box and telling your wife that she has to do it and worrying about that all the time, that's something that's affecting your life. Worrying about your kids all the time affects your life. I have a client right now that is dealing with that too. And just yesterday I talked to him and I said, maybe you should go to, I don't care if it's Christian, Buddhism, whatever it is, go to a temple, a mosque, I don't care, but ask somebody in charge, right? A higher up person, if they will talk to you about this fear and if they will pray or send good wishes or whatever, right, towards your children. Even if you don't believe it, if it's not going to harm you, why not try it? And he really liked that idea. He wasn't a spiritual person. He said, I believe something, but I don't really know what it is. But he said, actually, I'm going to do that. I'm going to Google somewhere and I'm going to go and then kind of know that someone else, it's not just all on my shoulders, I can't control things, but someone else at least is also caring for and praying for my family.
Mm-hmm.
Yeah.
And the thing with this lady is she was kind of passing on to her kids that being scared out in public.
That's a whole nother
thing
that was talk about.
On top of that. So that's a pretty common one for anxiety and OCD.
Yeah.
And then there's the traditional, cognitive behavioral therapy, where you sit there, you kind of find out the same information, but you do a lot of talk, examples, to try to get them to rethink it in a different way.
Right.
And I found that works to a point, but sometimes the exposure just works better.
Yes, or breaking the cycle, if we're going back to CBT therapy, of trying to say physically, can you do something to interrupt the thought? So if you always have this thought, what can we link onto that thought that is funny or stupid, like monkey, platypus, toast, right? And it can be a picture or a word, but if you can practice that, if they can practice it when they're calm, when they're not having that intrusive thought that I must do this or I can't calm down, right? Then your brain will start attaching that, linking that thought to it. And it's like, darn it, because it's interrupting that cycle. We also have people, they open up the drawer 5 times and we say, open up 4. Now stop, count to 3 or take 3 breaths, and now allow yourself to go to the next number, right? Anything to break that cycle of thought can help with breaking the behavior later.
And that's what I did with the kid when I touched the bottom of my shoe and licked.
Yeah.
You know, I did stuff like that all the time. And he came in, and I'd say, "I'm still alive,"
Still
you know.
here.
And he finally, believe it or not, something that stupid. I mean, I think we had the cat too. I petted Pepper, and did the same thing. And this poor kid probably thought I was. And I, you know, I'm a little bit of a germaphobe, and I kept thinking, "Watch, I'm going to die in front of this kid after doing this." But he slowly kind of, what he did, it didn't stop it, but he washed his hands more appropriately because he realized you weren't going to die if you got something on your hands if you didn't wash right away.
Yes,
so.
and the good thing about that is when we talk about exposure therapy, typically we're talking about the client to do it, or behavioral activation. However, you were doing it for the client. So they were exposed to it, but they weren't actually having to do it themselves, but it still had this wonderful long-term ripple effect that, well, he's still alive, he's still alive, he's still alive, to calm him down and get him a little bit more reality-based.
Yeah,
so that's terrific.
And I did ask him if he wanted to do it. He goes, "No, I'm
you
not
keep
going
on
to do
doing
that."
it.
So, you know, that's something else to do. And then biofeedback that we do here can really help, because what it does is when you do biofeedback, you kind of do the breathing or calming. You learn to do it before you're in a full panic mode. So a lot of times when OCD starting to kick in, like let's say, like if I was leaving, I'm like, "Oh my God, but the door gonna lock, and if it doesn't lock, is someone gonna come in and steal everything, and then Nancy's gonna fire me?" You know, it never goes that far. But anyway, you know, well, what you do is if I'm using myself as an example, as I'm going out the door, I just breathe and calm myself. And actually, what I do is I kind of push those completely out of my mind. I have a lot of practice. So it teaches you how to calm yourself before you become really anxious, so the behavior is easier to deal with when it starts. And that's the important thing, when it starts to, you know, rear its ugly head. So.
Yes, and again, you're practicing this when you're calm, and you're practicing this in session when you're doing biofeedback and hooked up to the machine, or you're practicing, you know, sometimes we also do visual stuff, and you may be practicing that those thoughts are going to the gate, and you're pushing open the heavy gate, and then all the thoughts are just going through, just like running through like horses, until you can know that they're out there, but they're so tiny you can't see them anymore. You're learning that I need to let these things go because they're hindering my life. And so there's all sorts of different techniques that you can have help with and be guided with. If you need help with your OCD, we encourage you to get connected with a therapist.
And we also have metronome too, which is good for that too.
Mm-hmm.
So that's just to give you an idea. If you go to a therapist, some of the techniques they might use to help you or somebody with OCD.
Yep.
So what I want to talk about next week is what you can do on your own to deal with OCD.
Okay, terrific. So again, if you didn't see the first one, we were talking about all of the different ways that you can kind of diagnose OCD. Some people think they're OCD and they're really not. They just have some intrusive thoughts and it's no big deal. So that was the first one. And of course, this one was about what techniques will your therapist use as far as interventions, or could use with you if you go into therapy. And then please join us again next Wednesday, and we will talk about what you could do just yourself at home. And again, if you have an idea of what you would like Pete and I to talk about on Wednesdays, please put that below. If you want to contact us, you can contact us below right here on this Facebook page. You can also get lots of tips about various things on our website, which is www.healthythoughtswellnesscenter.com. Log in, become a member. It's all absolutely free. You can join groups that talk about anger management, depression, healthy lifestyle, all sorts of different links to different things throughout the week.
Okay, good.
Okay.
I'm going to see you next week, and I'm going to go wash my hands. No.
After he licks his
Yes.
licks his bottom shoe, he's going to go wash his hands and live for another week.
Yes.
No, he's doing exposure therapy. All right. Have a great day. Please leave us a comment if this was useful to you. Thanks.